This patient of mine had 5 causes of her rheumatoid arthritis. I identified them all and treated them, and she was symptom-free in 2 months.
You're watching the Dr. Jake podcast.
I'm a naturopathic medical doctor and integrative physician in Salt Lake City, Utah. On this channel, I share with you how you can heal your body down to the root causes and get your energy back without any harmful drugs or surgery. Be sure to subscribe for more videos like this one. In this video, I'm going to dig into how I treated my patient with rheumatoid arthritis and give you guys a little bit of inspiration and ideas of how you can treat rheumatoid arthritis effectively. So this patient came in to me when she was 26 years old. She was diagnosed with rheumatoid arthritis when she was 17 years old. So she had been dealing with it for a long time before coming into me. And she actually hadn't done any treatment at all during that whole entire period of time. When she was 17, she decided, I really don't want to take these medications. She researched them. She didn't feel good about taking these medications. She was like, I really don't want to be at increased risk of cancer. I'm really young. How young I'm being diagnosed with this and starting these treatments this early, my risk of getting cancer is greatly elevated there. And she was just really concerned about that and getting chronic infections and not being able to heal very well and all the other myriad of symptoms that she read about. So it wasn't something she was able to do. But she wasn't really able to treat it very effectively. She did do a pretty good job. She learned about diet. She did take away some inflammatory things, and she was doing a pretty decent job. But it started getting really severe, and she started getting some joint damage because she wasn't treating it very well. She wasn't doing conventional or really treating it very well naturally. So she wanted to come to an expert doctor that could really treat it how she wanted to and just really look at the cause and not just suppress the symptoms. So she came into me. She told me what was going on. I found out about her history. I found out that she was working at a hair salon. Sorry for those hairstylists. Being in a hair salon, it's a chemical mess, and these chemicals can really affect your immune system. You're getting all these chemicals get into your skin and into your hair, and into your lungs through the air from breathing in all these toxins that are chemicals that are going out in there, and that's going to make your immune system see all these foreign materials, and it's going to go crazy and want to go attack certain areas of the body, cross-react with certain areas. And with her, it was rheumatoid arthritis was what came on there for her. So what I wanted to do is ask really thorough questions to really find out what could be the causes for her. So I wanted to find out about her energy. I found out that she was really tired most of the day, but she actually was getting more tired in the afternoons, and she wasn't able to really sleep very well at nighttime, and she would wake up really groggy. Wanted to really know about her digestive symptoms to see if there was anything related there to tell me, okay, is there something going on in the gut? I found out that she had constipation, gas, bloating. Was telling me, okay, there might be something going on in the gut. She was telling me that she has noticed certain foods makes her rheumatoid arthritis a little bit worse, and she was able to notice that certain foods were causing her digestive symptoms to get worse. She took out some of these, but she wasn't really identifying everything that was really causing the issues for her. I wanted to rule out if she had any type of heavy metal exposure. She asked questions about that, if she lived in an area close to an airport, or if she had a lot of dental amalgams, or she had any dental amalgams removed that weren't done appropriately, or she lived in a house with lead paint, et cetera, to really find out what was going there. I wanted to know about her sleep to see if there's any imbalances in her sleep. And she identified that she wasn't sleeping well at nighttime. The main thing was that she was waking up many times throughout the night, and that gives me some indicators that I want to really look at her cortisol production. I asked her about her stressors in her life to find out if stress could have been related to it. And that's just a quick rundown. I asked a lot more questions. I don't want to bore you guys too much with the questions really I wanted to do to identify what was going on with her. But I asked her a question. She gave me a lot of detail. And then I decided, okay, I know what labs I want to do now to really find out what's going on. So I did a detailed thyroid panel, TSH, free T3, free T4, reverse T3, autoimmune antibodies. I ordered a hormonal panel. So she was only 26 years old, so she was still having her cycle. So we need to check the hormones at a certain time of the cycle. Day 21, we checked her progesterone. Day 3 of her cycle, we checked her estrogen. We also checked her DHEA and her testosterone. I do this in majority of my patients, and especially in her, she had some digestive symptoms, but just because you don't have digestive symptoms doesn't mean that you don't have a food sensitivity. in about 99% of my patients with rheumatoid arthritis, I always see some type of food sensitivity. So I ordered a ALCAT test, which is a leukocyte histamine response test, to look at what type of foods that she could be reacting to. I checked 150 different foods. I also did a diurnal cortisol. This is looking at the circadian rhythm of your cortisol. That checks your cortisol morning, evening, nighttime, and right before you go to bed. So I can see if there's any imbalances going on there. I ordered some inflammatory markers like a C-reactive protein. I wanted to do a detailed look at her vitamin D and nutrient status and zinc and these type of nutrients to know what was going on in that regard. So I ordered this blood work, and then I had her come back in 2 weeks. When she came in, I reviewed with her what was going on, what I saw in the laboratory work, and what I came up with through the thorough questioning. What I found out is that I was seeing that she was producing way too much cortisol at nighttime. She was making too little cortisol in the morning and too little cortisol in the afternoon. So that's the total opposite of what we want to do. We want to produce a lot of cortisol in the morning, and then it waxes and wanes throughout the day, and it should decrease at night, but it wasn't happening in hers, and it was going way too low in the afternoon. Even though it will go down in the afternoon, it dips too much, and that was leading to some imbalances. Cortisol is very important for us to balance out our inflammatory processes throughout our body. Also, our blood sugar regulation, which increased blood sugar in our blood, will cause increased inflammation. So cortisol is a big piece of autoimmune conditions like rheumatoid arthritis, and we needed to work on balancing this out. I saw that she had a vitamin D deficiency. I almost see this in all my patients that aren't taking vitamin D, especially living in Utah. Even though we have a very sunny climate, most people are putting a lot of sunscreen on, not going outside enough. And during the winter months, for about 5 months, November to March, you're not getting really good sun exposure at all. So it's very common that I see that. But vitamin D is our main hormone regulator, and it's a big regulator of our inflammation and immune system. So if we don't have good vitamin D levels, these things aren't going to work appropriately. So we needed to put her on some vitamin D. I also saw that she had some dysregulation of her thyroid, so we wanted to help support her thyroid. It wasn't doing bad enough for me to actually want to give her some prescription, but I gave her some thyroid support. I did that through some herbs to help support her thyroid function. And then saw that she had all kinds of food allergies, so I took her off of those food allergies. And many times these food allergies that I see, they're not permanent. They're not like forever life sentences that you can't eat these type of foods for the rest of your life. Many times when we start healing up the gut, to get the gut healed up, we're able to eat a lot more foods. Now, talking about that, we do still need to stay away from inflammatory foods that are just inflammatory in nature. But usually when people get things calmed down, they can eat these inflammatory foods sometimes and not really cause a big problem. These inflammatory foods, the top ones are gluten and many times many grains, dairy, and refined sugar. These are some really inflammatory things, so I usually recommend staying away from these pretty long term if you can, or at least decrease them greatly. But we identified all kinds of other food allergies that were going on too. We took those out to just calm the fire, so to speak, that was going on in her immune system and calm her gut down. I also found out that she had an imbalance of her gut bugs. So she has something called a dysbiosis, which is meaning you don't have enough good gut bacteria in her gut. So we wanted to replenish her with some good probiotics to get that all under control. So I prescribed dietary modification. I gave several supplements to support the adrenal glands, the thyroid, heal up the gut. And then many times with rheumatoid arthritis, I want to do more aggressive treatments to get things moving appropriately. Oh, one last thing that I forgot to say here is that she had Epstein-Barr virus, chronic Epstein-Barr virus reactivation. So Epstein-Barr virus is mono. You get exposed to this when you're really young, but some people get exposed to it and it never goes away, but most it goes dormant and then it reactivates itself. And that's what was happening in her. I ordered an Epstein-Barr virus early antigen, and I saw that was elevated. It's telling me that there's a reactivation of her Epstein-Barr virus. That she didn't just get exposed to it, she actually had a reactivation of it, causing her immune system to be overstimulated. So we also formulated treatments to go after her virus. Like I prescribed high doses of vitamin C and zinc. These are some basic things. High doses of vitamin A, put a good amount of vitamin D to help, like we already talked about. And then I gave monolaurin. And I didn't feel like I needed to do anything more than that in that regard. But I did do some procedures for her. So I did IV nutrient therapy with glutathione. Glutathione is one of my favorite antioxidants and anti-inflammatory agents because it works on the cellular inflammation inside the body. And when we do it IV, it's 1,000 times more potent than we do it oral, even though I like to prescribe that orally, which I did do for her too. And then we put the nutrients in there to help support the glutathione so it's able to recycle itself and replenish itself and be able to be much more effective. So you don't want to just take glutathione, just like straight up just glutathione without any nutrients in it, because you're not going to get a great effect. You're going to get like 30 minutes of effect instead of 8 hours of effect. So we like to do that. Also, the nutrients are going to help support the adrenal glands and support the neurotransmitters in the brain and help heal the gut from the inside out. So a lot of things happen with that technique. I also prescribe hyperbaric oxygen therapy. So why am I giving her oxygen therapy when she has an immune condition? Because what happens when you have a chronic inflammatory reaction is that your blood vessels also get inflamed, meaning that you're not going to be able to deliver your red blood cells effectively throughout your tissues. So like into your joints, so they're not able to heal very well, like into your gut, they're not able to heal very well, the brain, etc. So what we want to do is do hyperbaric so that we'll get the oxygen right in the fluid base of the blood. So it's able to go through this narrow capillary that gets inflamed and deliver that oxygen effectively. Because when it gets too inflamed, the red blood cells aren't able to get in there very well. They're not able to collapse very well and get in there and deliver the oxygen. With hyperbarics, we're able to get it in there very effectively, decrease that inflammation around the capillary, and start regenerating and healing the body. We also, since she did have a Epstein-Barr virus infection, we wanted to do high-dose vitamin C. I did talk about the oral vitamin C, but usually we needed to be more aggressive and do high-dose IV vitamin C and help eliminate the virus that way. So that's the whole protocol that I put together for her. And we started doing this treatment over a 2-month period of time. And then I had a follow-up after 2 months to see how she was doing. Even though throughout the process, I was checking in, see how I was doing. She was able to answer all her questions throughout the process. But after this 2-month period, I was checking in, okay, what's happening? Are we getting the effect that we want? After the 2 months, she was telling me that she was feeling a ton better. Her energy was great. She was having very little joint pain anymore. And she wasn't as stiff when she was waking up in the morning. So she was doing really good. And she was really happy with how things were going. So at that point, I was done with all the procedures that I was doing with her. I let her go. I said, okay, we're just going to take the supplements for right now. We're going to do that for a 4-month period of time. I followed up with her in 4 months. She was still doing really good at that point. And I said, okay, let's play around with your diet. Let's start introducing new foods into your diet. We're being strict on taking away these food sensitivities. Let's start introducing these foods back into your diet and how you do it. You eat a lot of that food that you're introducing. Let's say gluten, for example. Even though that's not one I recommend for rheumatoid arthritis, you eat a lot of that. See if you have any reaction that day of, and wait 2 days without introducing anything new into your diet. And then we find out what foods you're still having a reaction to or not. She started doing that, and she was able to broaden up her diet a great deal, even though I did still keep away the anti-inflammatory foods for her. And she was doing really great. Followed up in a year, she started having some really stressful events. She also was still doing her hairdresser stuff, so she was still getting toxic exposures. So her symptoms started coming back again. So what we did is we started doing some touch-up treatments, is what I call them. We just did some IV procedures, some hyperbarics, get things not as aggressive as what we did before, but just put things in the right direction again, start following a more strict diet. She started getting back to where she was again, feeling really great. So I've been treating this patient for 5 years now. She comes in maybe every 1.5 to 2 years to do some touch-up treatments because she might have a really stressful event, or she might get a lot of toxic exposures, or she really went off her bandwagon on her diet for a while, and we just need to get her back on track. So I recently just saw her last week, following up with her, and it brought up her case, and I really wanted to share this with you so you can understand. If you do have rheumatoid arthritis or other autoimmune conditions, you don't have to absolutely take immunosuppressive medication to get over your condition. You actually can eliminate and put it in remission. I mean, what I like to say remission, because it doesn't mean it's totally gone. You're not having any symptoms or any issues with it, but let's say you go out, you don't follow your diet appropriately, or you get really stressed, these symptoms can start coming back. But if you follow a good diet and try to keep your stress under control, these symptoms will never come back, and it's like you don't have rheumatoid arthritis anymore. So she was coming in 2 times a week for 8 weeks is what she was doing with me. So she was coming to my office 2 times a week for 8 weeks, obviously following the diet and the supplements during that time. And then when she came in for her touch-ups, when her symptoms started to come back in about a year, we did about half the treatment we did before, and we had her come in once a week. at that point for a month. If you want to learn more about rheumatoid arthritis or other conditions like this one, click my videos to the right. I'm Dr. Jake, and I'll see you there.